To FDL or not to FDL? That is the question. So this is a common question I get, and I wanted to use the patient that I posted about 3 days ago. It's a lower body lift to sort of demonstrate sort of my thought process when it comes to FDL. So this patient came to me from out of town, and when we did our virtual consultation, we discussed doing an extended tummy tuck and an arm lift because that was her highest priority. When she came in to see me, I quickly noticed that she had a lot of laxity in her abdomen that sort of extended to her hips and her buttock. And I spoke to her about if these areas were a concern of hers. And I told her that my concern about just doing an extended tummy tuck was that I thought she might need an FDL or vertical excision. And the reason for that was that she had some skin that falls in what we call the vertical plane. So that means that if you drew a line up and down, there was a lot of skin that moves side to side. And especially when she also leaned forward, she was recruiting a lot of skin from her buttock area and her back, which was making that skin sort of tent even more in the front. And so I told her that if she just wanted to do an extended tummy tuck, that we'd have to do an FDL or she wasn't going to be happy. My other suggestion to her was that if her outer thighs and buttocks bothered her, which they did, we might be able to get away with doing just a lower body lift and may not need an FDL at all, or if you wanted one, potentially in the future because you would come back for other surgeries. Now, the reason this works is because when you think about a circumferential body lift, there's two circles that are being made. There's the lower cut, basically around your hips, which is generally wider than the second circle, which is made about at the level of the belly button. So now you are stretching a smaller circle to match a bigger circle, and that spreads out that skin, which may not require then that vertical incision because that skin is being stretched over sort of a wider area, which doesn't happen when you just do a tummy tuck. Now, that doesn't mean that you may not have a little bit of loose skin in the top, but that skin can also be fixed with something called a reverse tummy tuck in the future if there's some loose skin. Now, there's some patients that obviously need an FDL. I'm talking about patients that are sort of in that gray area that may need or may not need it. But a lower body lift can decrease your need for an FDL. And I'll discuss this again some more in part 2.